Welcome to yet another episode of Q&A with G and A.
Let's see how many times I can beat Dr. Huang.
If you didn't know already, Dr. A is very competitive.
Yes,
She
I
always
am.
likes to try to beat me.
I don't think this works. My fault. Okay, I'm done.
Okay, you know what?
There are actually several newer techniques for improving sperm selection. One of the ones we utilize a lot at Reproductive Partners is the Zymot, which uses a little chamber to select out sperm that has better DNA content. We also utilize something called Pixie, which again is a similar idea, but utilizes a special dish to select out better sperm.
For so long, we've always focused just on the egg. And this allows us, I think, not knowing kind of what full impact sperm selection has, allows us to kind of try to enhance, outcomes by perhaps selecting better sperm.
Did I say top?
Who won that one? Dude.
But I'll let Dr. Huang answer this one.
All right, okay. One common misconception is that it's very isolating. That a lot of couples think that it's only them that's dealing with the infertility. And the reality is that pretty common. 1 in 7 couples have to go through infertility. Begin the communication so that people are there as a resource for each other, not just us for the patients. People will feel less alone. Kind of because it's 2-0 right now. Disclaimer is that I tore my Achilles, and so as a result, I'm a little bit slower. So
The Achilles is in the foot, but yes.
but I also want you to show that I won one.
Yeah.
Sure.
Boom! That one.
That one.
Grading of embryos, we're going to send it to the PhD.
That's so kind of you. Embryos are graded either day 3 stage in development or day 5 stage in development. For the most part, we generally grow embryos out to day 5 or day 6, which is called the blastocyst. There's 2 main parts. Blastocyst has the inner cell mass, which eventually becomes the fetus, and the outer layer, which is called trophectoderm, that becomes the placenta. So the embryologist, based on cell symmetry and cell numbers, will give them a grade of A, B, and C. So it's sort of like a beauty pageant for embryo. Good grading does not necessarily make an embryo good, meaning good chromosomally normal. There's no correlation.
I would just add, Gayane, what do you think about now AI incorporating time lapse? And does that kind of add to the algorithm for grading?
Time lapse, to clarify for everyone, is when we put the embryos in an embryoscope. Embryoscope is where the embryos essentially get videotaped throughout their development, and we see how the cells are dividing, at what rate they're dividing, are they dividing symmetrically. So it's really fascinating. I think it's going to have a huge role in the next few years. Right now, it's still sort of in the testing stages. AI is able to essentially look at an embryo based on development and tell us whether that embryo has a higher potential of implantation versus not. But to this day, the best way so far to identify the chromosomally normal embryo is still with the PGTA testing. We're hoping that the field leads us to is that we'll be able to identify these embryos better with AI help, with embryoscopes, because that's less invasive. We don't have to touch the embryos.
Boom!
I won! I won't answer that one.
Secondary job, if I wasn't doing this, would be to be a magician.
I would have loved to be an embryologist. Be, a chef or a baker.
You-
Or a personal shopper. Pretty cool.
Yeah, but we'll watch this disappear later.
But it's gone.
But stay tuned. We'll look forward to answering more questions and going over some fertility with Q&A
With G
and A.